digital health encompasses quite a few things. It just means digital health even includes you coming into the hospital, and you know these cards people complain about, these government green cards that people complain about, they lose it. Yes, health passports, so they lose it and then they come, I know nothing about your history. So you've been treated recurrently for a mass in your liver. And you come to me now, and we must remember all these things are related. And I actually spoke at a press briefing recently, and I said it would be great to have a bit more of these sessions where we not just focus on questions, we focus on educating the community. The importance of digital health is not just what we've been focusing on to say consultations and this. It also is on the fact that it makes the system easier, and it makes it easier for the patient. And that's a part that's not often focused on. So instead of carrying this green card around, if your system is entered and we have your information, that means that when you come to the hospital, you enter your name, your surname, your ID, and immediately I have access to your data. It cuts down even consultation time. Because instead of spending 45 minutes to an hour consulting one patient because we're not able to access your history, we have the history. We don't have to rely on calling your uncle to give us a history. We have the history. We can make choices much faster, more efficiently. Also, with this so-called digital health that we speak about, there's the issue of, patient information, patient medical records. Then there's also the issue in terms of radiology, so imaging. What does that mean? That means that from the comfort of my consultation room, I can ask Dr. Finn, who is a specialist radiologist, and maybe at that point he's in Rundu. I can tell him, look, I did a sonar on this patient, and I'm not quite sure. It looks like there might be a mass on the liver. Can you confirm? They have access to the images immediately by logging onto the portal. And by so doing, they can offer a diagnosis, cutting patient time. What does this mean? This means, number one, the patient doesn't have to retell an entire history. Number two, importantly, we don't have to keep shuffling patients around. Go there and find your x-ray. Go in that queue so they can try and track your x-ray in a little storeroom. When we go around the country and all these visits that I've made into the various regions, we find rooms filled with, number one, patient files, paper-based patient files. Number two, rooms filled with x-ray films from years back. And you ask yourself, how can we operate more efficiently and effectively? Digital health is just that. It's answering the question, how can we operate more efficiently and effectively? That's it.
Wonderful.